What we're doing is we're going to show you the basic headache treatment that we do here in the clinic. It's very simple, it's easy to follow, and so we decided to give it out to the general public so people can help their friends and families with this treatment. And one of the reasons why I realized I could do this, my aunt had a migraine from having a stroke, and her daughter, they live in a different state, and her daughter was asking me what she can do about it. And so I sent her our PowerPoint and I FaceTimed her this treatment. And over FaceTime, she was able to treat her mom and resolve that migraine. And I realized that, oh, well, maybe this is something we should be doing. And so I'm going to share the whole treatment, and we're going to do it step by step. And so I'm going to actually treat this person real time. And so the goal is for you to have a person there and just follow along. And then eventually you can learn it, and you can find the things that are valuable and the things that aren't. And I'll talk about why things are working as we go. But this is just a follow along. And so you'll have the timing and all the locations of what to do precisely. So just do it with me, with your person. And you could do it on a massage table, you could do it on a bed, on the floor, it really doesn't matter. And these techniques that I'm going to show are very simple, they're very safe. It's very hard to hurt somebody doing these. We have techniques that are not simple and maybe not safe if you do it on the wrong person, but all these are very safe. And as far as it goes with the scope of practice of what we're doing, there's no scope of practice, at least in New Mexico, for lifting the skin off the body and these very gentle things we're going to do. And so with that, let's do the treatment. Okay, so I'm sitting here and I'm going to be working above the clavicle. And the whole point of this is to get the blood to clear out of the head. So if there's too much pressure or not enough pressure, we're going to maintain the cranium pressure inside the head by controlling the blood flow. And so you go, there's the collarbone. I'm going to go above the collarbone. I like to use this hand, and I'm going to lean in to bring her shoulder to her ear. I'm going to grab the tissue, just gently pull and hold the tissue that kind of bunched up above the collarbone, and then lengthen it back. It's really important that you're not working too hard. Don't overdo it. I'm just barely doing this because what we're doing is we're dealing with her nervous system. And we're getting her nervous system to let this go. And if she's a chronic headache person, she's gonna be really tight in this area. And so push the ear to the shoulder, or push the shoulder to the ear, crowd it, grab the tissue, and pull it back. You see, I'm not pulling this hard at all. It doesn't take much. There's a lot of nerve veins and arteries and structures in here that you don't want to mess with. So if you get it from the outside, you'll start creating a big change. And so what we're doing is getting the fluid to be able to drain out of her head, which is going to relieve the pressure in her skull. And I'm doing this real time. So I don't know if you can see on the camera, but I'm already getting a better pulse. I can see the pulse, it's a little better. I'm staying above the clavicle, to the chin side of the clavicle. And I'm using that shoulder to give me something to grab, and when I pull it, I just lift that tissue right there. And so what we're doing is we're doing a venous sinus drainage to get the veins opened up to relieve the blood pressure in her head. And so this is a major pathway to get it out of the head. So you have to start from the bottom up, because if we worked and opened up the head first and this was plugged up here, well, you wouldn't go anywhere. So you've got to open up from the bottom up. And this one's almost done. It doesn't take much. And if you don't know what you're on or what you're doing, just keep doing it anyway. It's okay. Because I was saying that this stuff, if you just get close, it seems to help a lot. And it's better than nothing, that's for sure. Now you can do is between the clavicle and the ear here, and just kind of lift this up a little bit. Pull it apart. And just work the skin. If you get this skin loose, then the structures underneath are going to let go. Okay, we just lift it, make sure it's loose. She's popping loose. Don't overdo it. Don't over pinch it. It's very gentle. It's very gentle. If you're leaving marks on the person you're working on, that's about 1,000 times too hard. All right? Gentle. Gentle. Just lift and let the body release it. Don't overrun the body. Just lift and let the body release it. Because in the end, her nervous system, her brain, is telling this tissue to be tight. In the end, that's what's really going on. And so what I'm trying to do is communicate to the nervous system that it's okay, relax it, and then I just give it a little tiny, tiny tug. That sucker's almost done. So the whole underside of the clavicle, from here to there. I'm using this grip or this grip, but this one works pretty good for this. You should be doing this on your friends and family, so don't be afraid to lean on them. Doing this from out here is actually weird. They don't feel supported. You got to get your chest and touch them. There we go. So that side is done. And we're ready for the other side. So we're going to do the other side. Okay, we turn them over and we do the exact same thing on the other side, above the clavicle. Crowd that shoulder to ear. Lift the tissue that kind of bunched up for you and lengthen this shoulder back down and open up this drainage. Take your time. This is real time. I'm doing it. I'm actually treating this, and this is how long it takes to let go. Yours may take a little longer. It's not going to be faster, though. It won't be faster than what I'm doing. I am very, very gently pulling this out. Very gently. I am not pinching the skin. I am lifting the skin. Gentle. And that really is the key, is not being too rough on the body. It doesn't like to be mistreated. It doesn't like to be handled roughly. It really doesn't. So, approach it gently. So I'm not trying to overpower or be forceful here, okay? Just wait. It's better to take like 20 of these little approaches than one big one. And if you're working on somebody who has chronic headaches, you may want to do this a couple times a week till the headaches get under control. If it makes the headaches worse, well, there's something wrong. Don't do this again for sure. But we've never had anybody with their headache get worse just by clearing and clearing out these drainage points. There. So that one just lifted out. See how long it took to get that out? I could have tugged that out in one big old tug, but her body wouldn't have liked that. And so I want to get some kind of cooperation with her nervous system, so I didn't tug it. And so now I'm going to work up here. You may be somewhere else. And just where is it tight? Where does it feel like it's stuck inside there? Take your time. Trust your fingers. Just go with your instincts on this. You know where it feels like it needs to be released, go there. Okay, I'm good. I'm good. The whole top of the clavicle is pretty good. Now I'm going to go from the clavicle to the ear, the line of the ear straight down the neck. Okay, we're going to do this side. And just release these. And there's nerves, veins, and arteries all underneath this skin. And if you release the skin, the structures underneath will tend to let go. We're just going skin deep here. It's very effective. It's a very effective treatment for headaches. It's about 80%. And so you've got the 20% of people it won't work on. But 80% of them, it's just something like this. So I'm just kind of rolling, picking it up and rolling it. It looks like this. Rolling, rolling, rolling. That's what I'm doing here, but I'm timing it with the shoulder movement. So wrinkling it up, making it tight by pulling the shoulder back, and just kind of rolling it in your fingers. Okay, that's good. Feels pretty good. All right, let's go to the next one. Okay, now we're going to move on to the cranium base back here. And so I'm going to get a grip like this underneath the cranium right here. So the skull goes down. You'll feel that bump in the middle of the skull. Go deeper, deeper, but have fingers on the cranium and on the neck at the same time. Okay? Okay, so I'm going to get the cranium here. So I got her head, and I'm coming underneath, and I'm going to just put these fingers and these ones like this at that spot I showed you. So I've got the top of my fingers, the bottom of my fingers here are touching the skull, and this side here is on the neck. And there's no pinky, because the reason why is because they need to sit flat like this, like that. I'm going to put my fingers under there, and I'm just going to wait. And so the weight of her head is going to do the work. And so part of her head is in my palms, and the other part are on my fingertips, like at this angle, like that. And I'm just letting the weight of her head do the work. I'm not pushing up into that. And I'm like right at the base of the skull. And you just wait. And you'll feel, at first it'll be tight under your fingers, and then later on it'll start to warm. That's the blood coming in, and then it'll start loosening up. And if I press too hard, I'm going to create a guarding. And so we're not trying to press into the tissue. We're just letting it sit on our fingers. And then once it gets warm, then start making little small movements to kind of break up the tissue under the skull where it meets the neck. If you had to do one move for anybody, this is the one to do. And so for her, I'm working on this right side. I'm doing like little circle, tiny, tiny circles, moving that tough tissue around and trying to clear out and carve out the whole base of the skull where it meets the neck. And it's just the weight of her head doing the work. But so she's half supported in my palms, the other half in my fingers. And just wait. Starting to go. And this could take 3 to 5 minutes. And that's just the way it is. Take your time. And so when mine is released, I'm going to go on. But if you're still sitting on tight tissue, then you need to pause the video. And when it releases, then start it up and we'll go on to the next thing. This little stirring I'm doing with my fingers, little stirring is the key. It speeds things up. And if you find something that's really tight, like a tight band between your fingers, push that tight band together and wait, like shrink it up. So if it's tight this way, push it together and you wait, and what you'll find is it'll start going closer together, and then once it starts loosening up closer, you can pull it apart. And we're not stretching, we're not massaging, we're just the weight of the head on your fingers. And letting it go. There. So now I'm doing pretty good. So I'm focusing over here on this side, kind of chasing it a little bit under here. So you want the entire base of the cranium loose. And it's a patience game. This is a patience game. Do not be too forceful, especially when you're working on somebody's head. There we go. So I think I've got the whole cranium softened underneath, and that's going to get you drainage at that point. Don't get in a hurry. This is going to take you an hour, but it's worth it. Okay, we're going to go up to the next drainage point. So, but if you're still tight, you're going to have to just pause, get it released, and then let's move, start it up again. The next drainage point is going to be the ear to that big hole right there. And it's going to clear this hole in the middle, which is the jugular foramen, which is a major restriction on a lot of people. And so I want one finger in the ear, like in the ear, and then I'm going to be as close to possible with a pinch grip, stabilizing here. Okay, so I'm going to get my pinch grip here because it's nice and loose now. I'm sitting like this. It's about that wide. Okay, and I'm going to come under here and I'm going to put a finger on the bony part in the ear on the bone. She cannot hear out of this ear. I have got my finger in the ear. And I'm stabilizing that bone, and I'm going to connect from this finger to this finger and see if I could get something to release there. This is a big one. Hold that finger in the ear on the bone. I'm going this way towards her eye. My motion is, my hold is towards the eye, and these are two anchored together. And it's the same as the last one. You just have to wait and let it release. When this tissue is stuck, the nervous system is in an excited state. It's in a guarded state. And it's actually having like a trauma loop, trauma responses. So you've got to take it easy and approach it gently. And it's going to let go. So I'm slowly moving this finger just a little bit, steering this up. I'm steering this just a little bit, and you could feel those two connecting. If you press too hard, you won't feel it. Don't press too hard. If you're hurting your fingers, you're probably at least 80 to 90% too hard. These are very gentle techniques. It doesn't take a lot of pressure. And then I think I got that one done. Okay, so that was this finger to the ear. I'm going to use the same C grip. So I'm under here, the C grip, and I'm going to focus on my thumb to this here. So I'm holding my thumb, and I'm going to go to the ear, the same spot, thumb to ear. And so there could be a diagonal tension across the body, across the cranium. So I'm holding my thumb. Looks like this on the other side. Diagonal to the ear. And just wait. And just let it melt. There we go. So that one just cut loose. So now I've got real loose cranium back here. This is why you just keep going. If it just won't let go, keep going because the next one may get it. So that's completely loose. Now we're going to do that on the opposite side. So get your grip, get the ear, and so I'm going to go this side of the body, index finger to the ear. And I'm just stabilizing the bone, but you've got to get your finger in that ear where you're holding the bone towards her eye. And do the exact same thing and wait. See the thumb grip? It's a real tight C grip, meaning it's real close together. I'm not squeezing it. And so now I'm getting a release. You can kind of steer the ear a little bit. And there it goes. So now I'm going to go this thumb to this ear. And the little motions I'm moving is you could barely see me move. You wouldn't think I was moving. It's such small motion between the two. And so I'm getting that diagonal tension. There it goes. Okay. So I am free, and her base of her skull is completely loose now. Okay, so we did this, we did this, we did the ear, we did underneath the cranium, and now we're going to do the suture lines. Okay, so we've got the skull. These are the suture lines, and they're the cracks in the skull. And so there's a ligament that holds this bone to this bone together, and there's a membrane over that. And the membrane is called the periosteum, is connected to that ligament. And as you go through the skull, as I turn this over, you can see underneath it's continuous. So inside, you have the ligaments that are connected, and it's continuous to the membrane on the inside. And within that membrane, embedded in your skull, where I marked with these pin lines, are veins. And these are veins that were there when you were a little baby and your skull was soft, and when your skull got harder, it created channels for these veins. And what we're going to do is we're going to release the tension on the whole outside of the skull, which is in turn going to release tension on the inside of the skull and relieve tension on these veins. And so you have veins running through the cranium, and this is a major pipeline, the straight sinus here. And so this is why you can work the outside of the skull to affect the drainage of the pressure on the inside. Now I'm going to be sitting on the sutures like this. And the sutures are these cracks this way. Okay, so we're going to start here. We're going to start right at that one. And so you're like, well, I don't know where those are. Well, you will. So to find that, I'm going to make a cradle for her head, just like that. And even if you're not even on the right spot, the cranium will still let go. This is why I'm showing this, because you really don't have to even be on the right spot to get a result. Okay? If you're on the right spot, you'll get a better result, but you're still going to get a result. And so cradle the cranium like this, and then cross your thumbs to about where you would guess this is at, because we're going to run this. We're going to do this all the way to this line. So I go to here. This way. So cradle, cross. Now, if you come in and you rub your thumb across the cranium, you may feel one of these dents. If you don't feel it, take your best guess, cross your thumbs, and release that tissue. It's probably going to be good enough. I'm telling you, don't worry about it. And then you're going to push your thumbs apart from each other right to the point where the person you're working on can tell you they feel it, which is way less than what you're thinking. Way less. And so you push your thumbs apart, so you're stretching the skin, so it looked like this, stretching the skin just to the point where they feel it, and then that's all you need. You're not trying to rip this stuff apart, you're just motivating it in the right direction. And you wait. And if this is hurting your thumbs or there's any real pressure in the joints of your thumbs, you need to back way off. Because I'm just barely on the surface of the cranium, pushing basically the skin apart from each other with a contact to the bone, crossing my thumbs. I might get a different view. There we go. That's perfect. Okay. All right, so we got the different view. And I'm going to sit here and wait. And you should be pretty comfortable holding this head in your grip. Her cranium is sitting right here. And you notice when I pick up her head, I get it and I roll my hands underneath, so there's no jerking, there's no grabbing. It's very gentle. And we wait. And what's going to happen is you're going to feel. So that one released, it feels pretty good, like it's looser. Then I'm going to go to the next one, right up the center to the next one. Okay, this is an important step. If you have someone who fell and they hit their head, this is what you need to do. I had a young man, and one of the reasons why I'm doing this is we had a young man, he's 3 years old, and he fell at the park and hit the back of his head. He fell 4 feet and just clunked on top of his head, and it just echoed at the park. And his parents called me up to go to his house and work on him that night because he was just disoriented and he was out of it. And they're worried. And so I went to his house, and it was like, should we take him to the hospital or not? They didn't find anything, didn't see anything. And so what I did was I did this. I did this little splitting on the area that was super tight where he hit his head. And then I did that for about 15 minutes. I had him sit on my hand, just like I showed you before, where you have the base of the cranium in your hand. Did that one. And I did this one on him until his whole cranium, the skin softened around and the blood started going again. And then after about 15 minutes of that, he was back outside, playing with his brothers and sisters, normal. And we checked on him the next day and he was fine. And you just get to these releases fast. When my kids fall and hit their head, the first thing I do is I come and I split these things right where the tension is around their skull and just get this thing loose. So once they're done crying and they're out of that phase where they can actually calm down a little bit, you get in here and you just open this back up and restore function to their skull. And it's a big deal. It makes a big deal. And so she's got a little tight one here. So she's tight right there. And so see, now I've got to let go of her head and I'm just working with her head flat. Let's get her hair out of the way. And so right here, there's a tight one. And so I'm going to split that one. I'm not barely touching this thing. And so, but I'm going to do this. I'm going to pull it together because this is so tight right here. I'm going to pull it together. And so I'm kind of crinkling up and wrinkling the skin. I'm pulling this way. I'm wrinkling the skin here. And so this is a position of ease technique. And so I'm actually pulling the tension together. And then once the tension moves, it'll start relaxing and coming together even more right there. I can elongate it and I go back into my elongation phase and just sit and pull the skin apart from each other barely. You should not feel this in your joints. And they should tell you at the point where they feel it, and that's as much pressure as you need. When we first started doing this, we were using way too much pressure and it was actually hurting the practitioner. There's one right there. And nobody wanted to do this. And then we figured out that we were just pressing way too hard. And usually by the time you get to this this part of the cranium, the person you're working on will just be like totally asleep. There. And so I'm steering it. It's hard to see because I'm barely moving, and that's the way you should be doing, barely moving. There we go. And so you got to do this little rubby thing to find the sutures. Now, her sutures are hard to find. So I'm literally guessing. And it's okay. It'll still work. Don't worry. Just get started. There it goes. And just get in tune with your fingers. Now, as you can see, this is where I'm at. This is my skull. So I'm here. And I want to go this way, and it goes like right to the edge of the eye bone here on the orbit. It goes right to the edge. See the green? We want to chase this down. Now, this is the big deal for headaches, is this suture. This crack. It's the coronal suture, and it ends here. We know it kind of goes to the cheekbone. Just take your best guess, because if you release, it's right here. But if I release it over here, she would still get some relief. So that's why I'm like, let's just get this information out there. And so this one, I like to do like this. I just put my hand, I like to do it like this. Now, I'm not smashing my hand on her head. She doesn't feel the weight of my hand. I'm holding it in the air, and I'm just pulling it apart like this. Just a little bit, and then steer it a little bit. I'm going to do this whole coronal suture. That's this line. That's what that means. And keep following along. If you get the blood to start draining out of the head, you'll get that cerebral spinal fluid overpressure or underpressure corrected, because it's controlled by the pressure that's inside the veins. So that's what I'm trying to do. It feels good. It'll help them sleep. It's really hard to mess this one up. See, she has a tension line between this one and that one, so I'm going to kind of stay on that. And if I press too hard, I can't feel those lines. See, I'm backing up from the suture. I just instinctively went this far apart. You can do it from here, but my instinct is to go here on here because the tension is greater over here. So that's where I wanted to release. So that's what I did. I mean, technically, I should have been closer together, but, you know, that's not where I ended up because that's not what she needed. So just follow your fingers. Trust your instincts on what you're feeling. Let your fingers guide you to where she needs work. Because you'll find all kinds of stuff on the side of the head, because the temporalis here is a source of headaches. It's a jaw muscle that lands here, and it'll get stuck in the nerves, and the arteries are squeezed into this jaw muscle here, because the muscle will tighten up, because if there's a guarding response, that muscle, entire section here, will guard. And so, and entrap the nerves and the veins and the arteries in there. And then the entrapped nerves, veins, and arteries will send a signal to your brain that it needs to be guarded, and just create more tension, and then you end up in a cycle. So what we're trying to do is break this cycle. The only way you're going to break this cycle is by gently working and not overpowering anything. I got one more. See what I'm doing? I'm just doing this now because it's just the strength I have to do that. I'm not working hard. Don't overdo this. That's the secret, is go easy. Go easy. You have to be very caring on how you do this work. Because you got somebody's head and they're literally in your hands. And so if you're angry or frustrated or you're anxious or you're worried about it, it's going to affect your treatment. It's going to affect the way that their cranium lets go. Because I'm touching her and she's going to start resonating and feeling that I'm anxious. She's going to feel that right through my fingers and then guard. So if you're angry, having a bad day, set that aside before you get to this work. And if you're in it and you're already in it, well, calm yourself down. Trust yourself. Don't be nervous. Trust yourself. So I'm going to go and I'm doing here. This here is the temporalis muscle that I was talking about. It lays down right here. We're going to do the edge of that muscle. And you may feel like a real mad nerve pop up right here. And if you do, well, go and split that nerve. This technique works really good on the whole cranium. I just, find something, I don't know, where that feels good to me. I'm going to do that one. And pull it apart, barely. Or push it together. I might push this one together. I'm pushing it together. It's going to let go. There it goes. So now that really worked well on that. So I like position of ease. I like pushing it together because it's faster. Right there. That one's stuck big time behind her eye, or behind her eye and her ear here. And there's a lot of stuff going on nerve-wise in this area, especially as I move back. But I'm on purpose not telling you all that stuff because you don't need to know it to be effective at helping your friends and family with these basic headaches. And I'm leaving it out on purpose. We have a very detailed headache classes and information if you want that, to go get that there. There. So I'm really, really happy with that side. And so this side is much tighter than this side. So I've got a little more to go here. So I feel I can compare the two just by moving the skin. I'm just moving the skin like, oh, okay, this one looser than this one still. So I'm like, okay, let me go. Fine. Okay, that's where it's tight. So I'm just wiggling the skin. Oh, right here behind her ear. It's tight right there. So I'm going to go get that. So yours may not be this way, but I need this, so I'm going to do it. And I'm just going to squeeze this tissue together. So I'm on one side of the tight band and one on the other, and push it together and wait. There we go. That was it. That's the one she needed. There we go. And I'm feeling for the veins, anything popping up, anything crunchy. Sometimes they have, it's really like, it feels all crunchy under here, like there's ripples. She's got a little ripple right there. It's like bumpy. There's bumpiness right there. So I'm going to go there, one side of the bumpiness, one side on the other, and push it together. On these bumps, you want to push it together. You want to do position of ease. Push those things together. And wait. So I'm wrinkling up that little bumpiness underneath there. And so she's had this treatment before, so she doesn't have much bumpiness in here, but if somebody hasn't had it, you may find this whole thing is just all crunchy underneath there. And if you go like this, you know what I mean by crunchy. If you don't know what I mean by crunchy, they're probably good. But if you're doing a headache treatment on somebody, they probably are crunchy. It just ripples and bumps all along here, and you want all those gone. There we go. And then I do like a little light shampoo, like the shampoo technique. We call it the shampoo in the clinic. And just make sure it's good. It looks pretty good. And we're going to do that same thing. You got a little one right there. I'm being picky, but you know, you should be picky. So a little crunchy bump right there. So I'm going to, and what that is guarded fascia over an irritated nerve, vein, and artery. That's what that actually is. That irritation actually is coming from her neck, but we're not going there here today. Okay, there we go. That's better. So she had a headache yesterday, and it was on this side, obviously, and so I'm glad she volunteered for this. Okay, we're going to do the other side. Okay, we're going to run from this one all the way to this one on this opposite side. All right, so just follow along. Now we're going to do the same thing on the other side. You don't know what you're going to find, so coronal suture, give it a little rub until you feel the little dip. If you don't feel the little dip, it's okay. Just between the ear and the eye, somewhere in there it lands. And so somewhere up here, it ends. And so find something and just start working. I literally mean this, like you don't need to know exactly where all this stuff is to get a result. And I'm pushing my fingers together. But I'm barely, it's just the strength of me to be able to do that, right? It's not strong. So take it easy. That's the secret, is go easy. It really is the secret, is do less. And talk to it. And so I'm doing little tiny stirrings with this finger. Little tiny ones to kind of find, like, where does it really want to let go? Oh, maybe there. And I'm pushing them together. So I'm going to position of ease this because I like it. Position of ease works better. And it's faster. There it goes. So now just really let go. See? Now that's loose. So go to the next section. Do the same thing. If you need more time, just pause it. I'm telling you, won't need is less time. You're not going to be able to do this faster than I'm doing it. I guarantee that. And so if you're done before I am, there's something wrong. Go back and do it again. There. That one just let go. Just trace it. I can't really feel her sutures. Oh, that's a good one, actually. I could feel that one right there. So I'm going to go do that one. And just, I'm squeezing them together. I'm not pulling them apart. I'm putting them together on this one. There we go. I'll let go pretty good. So pull it apart, put it together, whatever you feel. I like to put it together. Just make sure you're not overrunning it by pulling it apart too hard. You got to let it let go. You're not letting it. You're not pulling this tissue apart. You're convincing it to let go. You're talking to it. There it goes. There we go. Next one. There we go. Okay, now this whole section here, we're just going to feel around. Oops, you got a bumpy right there. Feel around for bumps and wrinkles, like these little crinkly crunchies. We call them crunchies in the clinic. Very technical term. And crowd those spaces. And there's nerves, veins, and arteries underneath there. This is usually a referral from the neck. There we go. or the jaw, jaw tension, but the nerves are here, come from the neck. So we'll do this, and we'll do some light jaw work, and we'll call it a day. Less is more. I'm putting these together. You'll find that what you found on the other side, you'll probably find something close to that on the opposite side. So sure, tension is more back here. That's where I'm going. It would be unusual for somebody with headaches not to have tension in this section behind the ear, above and behind the ear. There it goes. Working it, putting it together. There we go. So we're going to do a little jaw work. Let's check for crunchies, see if you got it. Now there's a little bit right here. I'm going to go ahead and do that, so that'll give you a little more time too to finish yours. Don't be afraid to stop the video. This is an hour-long process. In the clinic here, sometimes it's 90 minutes, but we do a lot more than just this. This sure is a good start, though, I'm telling you. So pull them apart or put them together. Just find tension lines. There we go. Pretty happy with that. You do your little shampoo move and feel around. For anything else. And what you can do is you can do that shampoo type massage. If you don't have time for all this stuff, this is a quick release of the cranium. It's just circles on the skin. So I'm not moving my hand up and down like that. It's the skin is moving. So it's not, so I'm not dragging my fingers across the skin and the hair. I am locking them off and I'm moving just the skin. So under my fingers is literal skin movement like that. And so that's how you would do that. And so just kind of get both sides now. So now the whole cranium's loose. You can kind of just get both sides like that. And that'll mop up anything you left behind. And if you only have like 5 minutes, just skip ahead and do this. It's not as good as all the other stuff, but this can kind of knock out a headache. It may come back, but like it may come back right away. But this is pretty good. It's just moving the skin, but not pressing too hard. Not pressing too hard. I'm like, the weight of this is like, I'm pushing down to the skin dents, and then my finger pads are just denting just a little bit, but not all the way like to the bone. Like I'm not pushing, I can't feel really a bone contact of my finger. It's finger pads. And we're going to do that on both sides. And just get this, we call that the shampoo. And just moving the skin around. And that'll kind of hydrate the tissue and open it up. And you could do that in the occiput in the back. This cranium base here. So I'm on the skull, not the neck. This is the neck. This is the skull. And just move the skin. That feels really good. It's a good mop up. And I had a COVID migraine. I had a migraine, a pretty bad one. And I had the person helping me, and this is all she really knew. And she did this and actually got it. It took her 30 minutes of doing this, and it finally resolved. And I was very happy to have it. Very happy to have that. And it made me very sympathetic to people who have migraines, because I had one in my life and it was terrible. So it kind of got me to focus on headaches. So then we wrote several hundred pages of headache manual after that. Okay, now I'm going to move on to the jaw, because the jaw pulls this here. And so I'm going to come, there's her cheekbone. So I'm going to go below that, there's the jaw, between the two, in this soft space, there's the masseter muscle, the buccinator, and you put your finger straight in. We'll do this hand. So straight in here and then S curve. So I'm making an S curve. So one finger's up, one's down. And S curve the jaw, or and try to get those muscles of the jaw to release by curving these out. And so there's our cheekbone right here. And so I'm trying to get as close and underneath this cheekbone as I can. Now, I'm getting it and I'm turning and trying to, we call this scissoring because it's like a scissor. And I'm going to scissor this muscle, and it's called S curves in the osteopathic manuals. Here, and then so you could pinch and lift or S curve. And try to get along the entire jaw, all the soft tissue, all the musculature. And get all that loosened up by S curving. That's pretty good. And you can come in and just do that same wiggle on that. It's not the skin, it's wiggling the skin deep, and I'm moving the skin around. So it's not my finger on the skin. It's me moving the skin in relationship to the musculature underneath, and wiggle that stuff out. Okay, so that is pretty good. Now, I'm going to take this hand, I'm going to go, there's a jawline. I'm right here. I'm going to get as deep under there as I can, right there. Now, tricky. This one's a little tricky, but it's worth learning. It's worth learning. I'm going to take my thumb and put it in the ear here. This finger is going on the bone, on the bone, on the bone, until I find the contact of the lobe to the skull, but it's more skull than ear. Then my thumb goes in the ear, so I got it pinched, and I'm not lifting this lobe. And then I just give it a little turn to pull the tissue from inside the ear. It should feel really good to the person you're doing it to. If they say, ouch, you're doing something wrong. And then underneath this finger, I'm connecting these two together. And this is going to get the tissue underneath this bone. This is a very important one. And it releases so much. And I'm just going to pull these back and forth until it starts to release. It should feel pretty dang good in what you're doing to their ear. If there's any pain, you're doing something wrong. It could be too hard. Most of my pressure is on this underside lifting. So I pull that, you see your ear move? That really shouldn't move. You shouldn't feel these connected. And so if the person you're working on is just not connected, then that's good. And so now I'm starting to dig underneath the jaw a little more and lift the ear, push the ear down, hold, pull the ear up, push the ear down, hold, pull the ear up. Most of the tension is coming from this finger. And it's going to let go. There it goes. And so take your time and release the tissue under this bone. So under the jaw is really what you're going for. Take your time. You can go ear to the muscles of the mouth here. This is the masseter muscle. And see, does that pull? If that does, release those two from each other. Just stabilize the muscle, pull it away from the ear, and then pull the ear away from it. I'm pulling like grams of pressure on the ear, ounces. I'm not sure how many pounds, but I'm barely touching it. She can't hear out of this ear when I get this grip because my thumb is in it. This is a major release that is really worth taking your time to figure out, and just figure out on yourself and see what feels good on you, and that's probably going to work. Now I can lift and see, now I'm really pinching up the cheek muscles, and I feel like that is pretty good. Is this good? That's pretty good. Okay, we're going to do the jaw to the ear on the other side. Okay, we're going to do the jaw on the opposite side, and we're going to start with the S curves. Find the musculature. So you got the jaw, the cheekbone, go right to the point where they come together, like that, and come towards the lips until you get a soft spot, and then start just splitting these muscles apart, curving this. And your question is probably, couldn't I have done both at the same time? Well, you probably could have done this move both at the same time, yes. But you can't do the ear to the jaw. So it's better to take your time and like set an hour aside. Calm yourself down, because you got to be calm to do this work. And I'm just finding tight stuff and pushing it around. There's something tight there. Now that one I could do this technique. So I'm moving the skin. It's not my finger moving on top of the skin. That ain't it. Move the skin and move the deep muscle at the same time. And I'm staying pretty close to the bone here, because the attachments where it comes into the bone that's where you're going to get most purchase of your releases. Now I could S-curve it. See, I had to do that because I couldn't even begin to do the S-curve techniques because she was too tight. I remember that she had a headache on this side last night. There we go. And don't be afraid of doing it wrong. So I'm just catching this and I'm just lifting and pulling it away from these bones here because that's what it needs. So I'm leaving my own instructions, what I did on the other side, on this side, because S-curve's not working. It needs this one. And so this is what I'm doing. And so when you do this again, you'll know, well, there's another trick. There we go. Almost got it. It should feel really good. If there's any pain, if there's any discomfort in what you're doing, then there's something wrong. So you got to have the person you're working on give you some feedback. And then I say, work on your own jaw. Do this on your own jaw and feel it. Does it feel good? Then it's probably going to feel good when you do it on somebody else. And what we're doing here is releasing these muscles because these muscles contribute to this side of the head. Okay, so now we're going to the ear. Trace it. So trace the bone all the way. So I'm like on the lobe, but I'm still touching the bone. Put your thumb in the ear so you cannot hear out of this ear now. I got my thumb in there. And now I can control deep inside the ear. I'm not trying to pull the lobe. This ain't it. That's not it. Deep. And then get underneath the jawline here and start connecting the ear to under the jaw. See, if I pull this jaw, if I pull this, the ear goes with it. That's not supposed to happen. That should be free. So let's clear that. Trust your fingers. I think that's where people get derailed with doing this kind of work and trying to help each other, is like they don't trust what they're feeling. Trust it. You know what something that's too tight feels like. If it feels wrong, it probably is. So I'm holding and steering the ear and stretching this tissue out under this bone. It really is under the bone, under the jaw. And we almost got it. The first time you're doing this, you're learning. Your volunteer person is probably awake and hopefully giving you feedback. But by the second time, they'll be fast asleep. Like they'll just go right to sleep. And if you have children who are having trouble sleeping, do this move here, one where you just have that and sit, and then do these. They'll fall asleep, and they'll sleep great. And sometimes it's like the cranium that's not fully moving, especially kids who are C-sectioned, because your cranium requires the squeeze of the vaginal canal to set the bones in motion. And so they didn't get that. And so some of these kids need cranium work. There we go. So she's releasing now. And that timing's about right. It's about right. So I'm carving out the underside of her chin here. That's about right. And then I'm going to take it ear to the cheek here. So there's the jawline. There's the cheekbone. You come down to the V. Right there is where the V drops off and it becomes soft into the muscles. And then pull those muscles away and pull the ear away from that. It's a major drainage line under there. And this will get the front of the face to drain. There we go. There. Okay, so if you're having fun and you're working on somebody who's unconscious, totally knocked them out, go back and check things up. You could do this, check. A couple tricks you can do is you can pinch here, gently between the eyes right here. I'm going to turn you right there. So lift the bridge of the nose, hold that. And so I'm holding this finger here, that fascia. I'm lifting the bridge of the nose up. It's called the glabella. And then find something that locks from there along the top of the eye, the orbit here. And see if you can get anything from there to unlock. This is a major release point, is this where I've got this nose. You can feel over here, along the forehead. You can feel, there's a tight line. Release that. You may slip off, it's okay. My tension is mostly on this finger. So I have to reconnect because she's got oil on her face, and so I've got to reconnect and get the tissue, the fascia right there. So I'm on the glabella. It's called the glabella. And release things in the head according to what this is telling me to do. You take the glabella on down, the side of the nose. So I'll do it this way. I wouldn't do it this way, actually, but so you can see along here. So from here to there, that's a big point on her. I'm going to do that. So I'm running the whole nasal sidewall on the bone where the nose connects, and it's more face than nose. And break these two apart. This is like those frontal headaches. It worked pretty good. Okay, so I'm going to do the opposite side, glabella to bridge of the nose. Here. So I'm doing this. Like that. Running this down. So I'll do it like this so you can see, but same thing as the other side. And it's just the rest. The cranium all responds the same way. It's very thin, so you don't need a lot of pressure. There's not much in the way between where your fingers are and the tissue that needs to be released. It's not like you're going deep into the body here. Okay, so I got this along the edge of the nose. Then I'm going to do right here on the top where the top of the teeth are and the edge of the nose here, where the edge of the nose comes in. I'm going to lift that and lift this one up and apart. And she'll feel that right through the nose. And what she's going to feel is pretty good release between my fingers. And just light, be easy. It's all gentle. If your hands are hurting by now, you're going way too hard. Way too hard. Don't overrun your releases. Let the body release. You're letting the body let go. You're not causing it to stretch. You're allowing it to unravel, and you're helping it along. There it goes. So that's a good one right there. There you go. Now, and just check and do a little mop up. Feel like you got anything left that needs to be done. Check in. If you feel like, if your gut's like, oh, I really need to do this spot, go do that spot. But for now, I think she's pretty good. And so that's our basic headache sequence. It works on 80% of all the headaches we've seen. So I hope that helps you out with your friends and family.